Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. We had a little misstep. We're back at it. We've got Dr. Phil Chan on. Dr. Chan, is your audio working correctly now?
It is. Thank you so much for having me.
Excellent. So let's jump to it. The state of Rhode Island's healthcare system is battered and bruised right now. We've got CharterCARE, one of the major healthcare systems, in bankruptcy. It's being looked at to be purchased by an Atlanta-based organization. We've got Thunder Mist, who almost went under. That's a major provider. And now we've got Anchor, that is going under and closing doors and putting out as many as 25,000 people losing their primary care physicians. Let's start at the big picture. What's the problem with healthcare in Rhode Island?
So, healthcare in Rhode Island is under tremendous stress, ranging from the hospital systems to primary care. I spent a lot of time looking into this, and at the end of the day, I think that the biggest issue is that Rhode Island is a small state. We have less funding compared to a lot of states. We have fewer insurers, fewer payers, and this just creates a ripple effect across our state where we just have less money going into healthcare, especially compared to other states.
Is that on a per capita basis? Because there's other states, and listen, I haven't looked at South Dakota, North Dakota, Vermont, Delaware, Hawaii, Alaska, small states that have very small population bases. Is this a similarity across these other smaller population states?
It is a similarity, and I'm reminded too that what we're seeing here in Rhode Island is reflected across the US. It's not just a problem in our state. You'll hear a lot of talk in the media and across different sectors about the issues with healthcare in rural America. So again, it's not just Rhode Island, it's affecting many other parts of the US, and especially settings that are more rural, just delivering healthcare to these parts of the US.
There's been a lot of focus on primary care physicians, the lack of them, how difficult it is to get a new primary care physician, but also simultaneously the value of primary care physicians and how they can help improve the overall healthcare system. We talked a few weeks back about issues like addiction and how when primary care physicians are sort of embedded in the information, they can help pick off problems almost before they happen. Talk about these two, competing factors, the need for primary care physicians and the lack of primary care physicians.
So when we talk about primary care, we're talking about internists like myself, we're talking about pediatricians, we're talking about family medicine docs, nurse practitioners, physician's assistants. This is where you go, right, to manage your primary care, your chronic diseases that you may have, and to be screened for things before they're a problem, to be screened for things like high blood pressure, diabetes, cancer, right, things before that they can potentially kill you. Primary care is really the front lines and the foundation of the healthcare system in this country. It's really, really important that we have a strong primary care system, not just in Rhode Island, but across the US.
And then what's the breakdown? Was this a problem 10 years ago and now it's just sort of hitting the media? Or is this a decay in sort of the system, less doctors, more demand, the need for primary care physicians to do more even during that 15-minute visit once a year?
So the shortage of primary care providers has been a problem for a long time. I think it was exacerbated by the COVID pandemic when a lot of healthcare workers became burned out, a lot of folks took early retirement, et cetera. And now it's really approaching crisis levels, as you mentioned, with things like the Anchor closing, the pressure on the hospital systems, et cetera. The estimates here in Rhode Island is that we're anywhere from 100 to 300 primary care providers short of where we need to be to really provide adequate primary care to the state. So we definitely have some work to do.
That doesn't seem like, I hate to say it, it doesn't seem like a big number, right? That if the state made an effort to retain more physicians who are graduating from Brown Warren Alpert as an example, or to recruit more, will pay off your student loans if you move to Rhode Island, or whatever the factor would be. 100 to 300 doesn't seem like a big number compared to $1 billion for Broken Bridge or any number of faux pas that we've got competing right now.
I agree with you. The issue is, though, is that each medical school class, including here in Rhode Island at Brown University, our only current medical school, and just others elsewhere, they have such limited spots. And the majority of folks who are coming out of schools are really subspecializing. The issue is that primary care docs are not paid a lot compared to other specialty. There's more demand on a primary care doc's time. There's a lot of stress, things like prior authorizations, administrative burdens, referrals, the EMR. There's a lot of incentives to actually not go into primary care. And I'm reminded that when you're a surgeon or a neurosurgeon, that you're being paid many-fold higher than a primary care provider. So there needs to be multiple fixes to the system, in my opinion, one of which is sort of addressing some of this income gap between primary care providers and other subspecialties.
And we're talking about a major difference. We're talking about radiologists and surgeons making towards $1 million a year or more, and primary care physicians making $200,000 to $300,000 a year. Is that the ballpark?
That's exactly the ballpark, and I have nothing to complain about my salary. The problem is that when you're a student who's coming out and making these decisions and deciding between, and you're having loans, right? So one of the big deciding factors is, tens to hundreds of thousands of dollars in student loan debt for medical school. It's very appealing to choose some of these other specialties where you're being paid upwards of $1 million per year compared to primary care, with the lower pay as well as with the added stress and the administrative burden.
Let's talk about potential solutions. What is the state doing now? Is there any effort coming out of the governor's office, the legislative leaders, to address this? Are they focused? Do they have meaningful policies that they're trying to implement that could be in this year's budget to try and turn this around?
So the state is focusing more and more attention on these issues, and I think people are realizing that it is an important problem. In July of 2024, the state did form a state commission to look at this. They're looking at how to improve and retain our healthcare workforce. And importantly, they're also looking at a medical school, the University of Rhode Island, something that I'm personally a supporter of. I think that would be a big boon to Rhode Islanders. So we're looking forward to their report in the coming months. There's also efforts in the state legislature to increase reimbursement rates. I think that that's really super important. At the end of the day, we just need to increase the flow of funding to clinics, to providers, in order to attract and attain the talent that we need to in primary care. And finally, there's some other efforts to decrease the administrative burden on providers as well, which will hopefully, make primary care more attractive.
And talk a little bit about, the UMass system. UMass has a major, major medical school in Central Mass. It's, high quality, very, very distinguished. It's made, another feeding system into the massive healthcare system into Massachusetts, which is generally rated the #1 healthcare system in the country. And by the way, Rhode Island is generally in the top 5 to 10, almost in every measure you see. So we can only imagine what it's like in some of the poorer states. What's the, it seems like a no-brainer for URI to sort of tackle that. PC added a School of Nursing, which opened up this year. This seems to be where the future is, where the demographic is. It seems good idea, good business for these universities.
I tend to agree with you, and most states do have a state-sponsored medical school that they use to train healthcare workers, physicians for their state, especially in primary care. There's the UMass model, there's certainly University of Vermont, that's actually where I trained. But there are a few states like Rhode Island that don't have state medical schools. I think, though, it's offset by, and the concerns that have been raised about a state medical school include things like costs. So it may actually be a cost to the state to get a program up and running. It may be a cost per year over time, and also the ability of Rhode Island to train more physicians and providers. So as a physician myself, one thing that I routinely do is take students, including Brown medical students, to train. And so we have to look at whether or not we as a healthcare community can actually train folks that would be going to medical school like URI.
But don't we have doctors coming down training from BU down here in Rhode Island? And that seems to be, geez, if we can train BU students, can't we train URI students in this hypothetical situation?
For sure, but it's not quite as much as other states. So as an example, when I was at the University of Vermont in medical school, I did a 1-month rotation at Brown that solidified my interest in coming here. So that was important actually to attract me. I wanted to experience and see Brown in Rhode Island before I actually moved here back in 2006. So I think that there's also that balance there where we want some external folks to come here to see our system with the potential of attracting these folks in the future.
If you've got sort of one recommendation to state leaders, what is it that they need to do immediately to shore this up? Anchor closes at the end of June. Literally tens of thousands are going to be searching for a primary care physician in a system that has no capacity.
My personal opinion is that we need to increase reimbursement rates to physicians and specifically primary care providers. I think that that will have a downstream effect of supporting the clinics, increasing funding in general to the primary care settings, as well as increasing payment rates to physicians and other providers, which will in addition retain and attract other providers coming into the state.
Dr. Phil Chan, as always, we greatly appreciate your expertise each week on GoLocal. If you haven't seen it, GoLocal's got a big story this morning on the same healthcare realm. It is since 2020, which physicians had settlements regarding malpractice of $1 million or more. There's a lot of data there. There's also links to be able to look up your doctor, see some information from the Department of Health, and be able to scan things. Obviously, a malpractice settlement should not necessarily impact whether or not you use that physician, but it's a data point for you to consider. For everybody else, stay tuned. I cannot believe it's only Wednesday morning. It has been a rock and roll week already in the news front and sports. A lot going on in college basketball in this off season. Stay tuned for updates throughout the day. Thanks, everyone. Stay safe. Enjoy the great weather.